which is always a little bit embarrassing. And I'll start sharing my screen, and then I'm going to hand it over to Gillian, because she's the person you really want to hear from today and not me. There we go. Excellent. Hopefully you can all see that. But today we're joined by Gillian Vince. She's a SEND strategic lead from Northumbria Healthcare NHS Foundation Trust, and she's going to be talking to us about the role of a SEND strategic lead in a healthcare provider organisation. So I'll take it away, Gillian.
Lovely, thank you, Thea. Hello, everybody. I'm feeling immense pressure to say exactly the same thing as I've just said in the last workshop to make sure that I say it the same way and you get the same information. But hello, it's lovely to talk to you about my role as SEND strategic lead for Northumbria Healthcare Trust. Just on the next slide, please, Thea. What I wanted to talk to you about in this workshop today is just to share information about the role, the background to the creation of the role, to share information around the outcomes, outputs and impact of the role as I see it across operational, organisational and strategic levels in relation to governance and assurance and quality improvement, and to share some information about about partnership working and how the role complements that of the DCO and the other local area SEND leads that I work alongside, and then just finish with some thoughts about replication of the role across other provider organisations as part of the effective practice for SEND system improvement. So that's what we'll cover in the next 20 minutes or so. So just in terms of background, Northumbria Healthcare Foundation Trust covers a wide geographical area in the northeast of England. We provide services to the populations of North Tyneside and Northumberland. From a SEND system perspective, that means that staff in the trust work with 2 local authorities, 2 at-place ICBs, and we're part of 2 local area SEND governance and improvement arrangements. Within the trust, services working with children and young people are split across 3 different business units, and each business unit has their own priorities and governance arrangements, and historically SEND didn't really feature within that. Taken together, those arrangements made creating a coherent trust-wide approach to SEND quite challenging, both for partners in the local SEND system and from within the trust. Partners in the ICB and local authority were just trying to liaise with multiple people within the trust, usually heads of service, to try and share information and link together and plan system-wide improvements. Trust services were aware that EHC needs assessment compliance was quite poor, and we didn't really have a robust system for cascading requests and monitoring returns within timescale. We had lots of calls from local authority SEND officers chasing up late advice, etc. We knew there was a need to improve SEND awareness at all levels of the organisation and look at how we support the workforce in their understanding of the Children and Families Act and the Code of Practice, and to look at their service provision through that lens. So that led to the creation of the SEND strategic lead role in the organisation in 2019. Just go to the next slide, please, Thea. The role was created to try and address those issues that I've just talked about. The role was allocated to me. I'm a paediatric speech and language therapist by background, and my clinical history is working with children with special educational needs and disabilities. I also have a role as a senior manager, so I manage speech and language therapy along with paediatric OT and podiatry. So the grade of my existing role lent itself to be able to take on the responsibilities of a strategic lead role within the organisation. So the initial aims of the role were to try and improve the governance of SEND within the trust, to strengthen quality assurance of trust contributions to the SEND agenda, and to build workforce understanding of SEND and drive forward improvements in SEND across services. The role would enable a single named lead who could be the focal point of SEND within the trust. So for our partnerships and other local organisations, it meant there was a go-to person within the trust. It also enabled having a strong health provider voice, which is distinct from but does complement the role of health commissioners within SEND partnership discussions. So they were the core aims of the role. On the next few slides as we go through them, it's just how I've summarised what I feel the impact and the outcomes have been of the role, and I've just kind of themed them into areas for discussion. So in terms of governance, as a result of the role, we've been able to establish SEND within the trust governance arrangements from service right up to board level, and that's represented visually by the dark blue structure. So each service working with children and young people has a SEND champion. The SEND champions meet on a quarterly basis at our Trust SEND Forum, along with the two DCOs, the DCO from Northumberland and the DCO from North Tyneside. And the SEND Forum enables information cascade from services through the system and through the system to services and individuals within the service. The SEND Forum also allows for monitoring progress against our Trust SEND action plan. EHC needs compliance is reviewed at the SEND Forum, and we can link in with trust-wide governance and requests and assurance around that. The strategic lead on behalf of the SEND Forum reports to the business unit boards, which then feed into the executive boards within the trust. So we've now got SEND embedded as part of the trust's 5-year planning cycle and subsequent annual planning cycle, which sits underneath that. The strategic lead post also provides a link to the local authority and ICB governance arrangements around SEND, and that's shown in the red link between the two structures. So we can feed into the partnership SEND governance arrangements, but also crucially provide a provider representation on the local area SEND strategic boards, subgroups and work streams within that. So we've now got SEND established within the trust governance system, and we've now got a provider voice within the SEND local area SEND governance system and assurance frameworks, which really helps to drive forward improvements. So on the next slide, Thea, is just thinking about the impact around workforce engagement, which was one of the principal aims of the role. So the role has allowed for raising awareness of SEND at service level and at a strategic level within the organisation. It's allowed executive and business unit directors to understand what the SEND ask is in terms of statutory responsibilities and the ask from partners in terms of SEND improvement work. It's established a support network for staff, and some of these things include co-producing SEND basic awareness e-learning training that was co-produced across education, health and care. So all services across the system and staff within the system access the same e-learning. It's allowed for a rolling attendance at service meetings, and can't underestimate the named point of contact. It's somebody that staff can go to be supported. So I don't have the answers to all of the questions, but it's somebody that staff can go to, and if I can't answer it, I can signpost, I can find out the answers for them, and that's really been important. It's enabled SEND queries and conversations to stay live throughout our service provisions, and mechanisms exist to cascade information to SEND leaders and to services across organisational boundaries. We're able to listen to staff and understand what their training needs are and how we can support that. So, for example, we were hearing from staff with the increase in requests for health providers to attend tribunals, because we have an increase in tribunals and a marked increase. Staff weren't really feeling very confident around that. So we organised for the Trust legal team to put on a bespoke, quite informal training session around SEND tribunals, question and answer session, so that staff could really ask those questions and query those things they were unsure about and receive answers around that. And that was really, really well received. We've got opportunities for staff to be part of multi-agency quality assurance audits of EHCPs, to have that shared learning alongside colleagues in education and social care around how their education, health and care needs assessment advice is translated into a final legal written document. And it's allowed us as a trust to be inspection ready. So because staff understand what the SEND ask is, and we have processes and systems in place to support that, then when we do have inspections, preparing for inspections, staff know they're ready, they know what information's needed, they have that information to hand, they can go and showcase their service alongside their colleagues, both within the trust and outside the trust. And that's been referenced in the 2 SEND inspections we've had while I've been in this role, and the 1 mock inspection we did to test the new inspection framework, where the role was referenced in the feedback from inspectors. And trust staff also fed back that they were really engaged and confident to take part and provide the requested information because they knew what the SEND ask was. And on the next slide, please, Thea, just thinking about the impact of the role in terms of communication. So that's it. We've developed trust guidance for staff, which we review at the Trust SEND Forum on a 3-yearly basis. So there's a go-to document with advice and guidance. Just simple things like we created a send page on our trust intranet. So if anyone's got any queries, they click under S, send comes up and all the information's there. So within the send intranet page, there's the link to e-learning modules, sources of information, links to the parent carer forum. There's all of our SOPs, there's local area updates. So all information is in one place for staff. We promote SEND through the Trust social media channels. We make sure that our services review their local offer information on an annual basis based on feedback from parents, carers, young people and users of the service that we get from the Parent and Carer Forum. We've engaged in You Said We Did engagement with a Parent Carer Forum supported by a widening participation officer. So the role is enabled the information that we receive to be cascaded to services so that we're not asking parents and carers the same thing over and over again. We ask them for their experience once and then we cascade that information across services and then act on it and then let the parent and carer forums know that we've acted on it and what we've done. So that's been really helpful. I think having a provider voice enables health information to be included and embedded within the self-evaluation and updated as things change within services. And the SEND performance data set that's fed through to the SEND strategic goals obviously has a strong health component. And I'm able to sit on the performance subgroup so I can see that data. Where there are questions about that data, I'm able to go away and find the information out, do deeper dives into things, and then provide the narrative around that to the SEND Strategic Board for assurance. So there's some of the things to highlight around communication. On the next slide, please, Thea, just thinking about the impact around quality. I know the visuals in this slide are quite small, but it was just to give you something different to look at than a lot of words. So we've developed a standard EHC needs assessment advice pro forma, which all staff use when providing needs assessment advice. And we've received really positive feedback from the commissioning panel and from SEND officers about the quality of the information that comes, and the standardisation of that makes it easier to be able to lift and shift information into the final EHCP. We've got a trust framework for quality assurance, which is audited every 6 months, and there's an action plan sits alongside that. So we look at the SEND forum at that action plan, and then the SEND champions from each service take that back to their service. And this enables us to try to maintain a consistent quality of advice, even though we have staff turnover in services. We've noted improvements over the last year in making sure our advices are jargon-free, that we're clearly explaining the implications of health needs for the daily life of the child or young person, and that recommendations stay within professional boundaries. I would say maybe 5 years ago, we would occasionally have health advice recommending what school a child needs to go to in the EHC needs assessment advice. That doesn't happen anymore. So we've made some improvements in that area. That quality assurance is part of the overarching quality assurance framework that we have across the SEND system, which includes the multi-agency audits of EHCPs, of which health staff are represented. And as strategic lead, I sit on the quality assurance subgroup of the SEND board. So we feed into the wider SEND system quality assurance framework as well. In terms of timeliness, on the next slide, please, Thea. We now have a central oversight and process and coordination of EHC needs assessment requests, and everybody within the trust is aware of what the requirements are, and we have a SOP to reflect that. So we monitor the quality of the advice, and we also monitor the timeliness, and we feed that back through the business unit governance boards, so that our business unit leads and executive leads are aware of our compliance with the statutory obligation. So there's 3 lines on this graph. The overall line for the trust is the dark blue one, the light green one is compliance in Northumberland, and the light blue one is in North Tyneside, so we can differentiate the 2 areas. But broadly speaking, you can see when I started the role, it was quite low. In 21 to 22, our compliance was generally annually 66% of advice returned within 6 weeks, and 2023 to date is up to 89% and is staying quite stable in that area. So we are much better at returning higher quality advice within the 6 weeks time scale. On the next slide, just thinking about the impact of service development and quality improvement. So the role has enabled areas of unmet need to be escalated and discussed with partners in the local authority and the ICB. And that has resulted in additional investment in services in the last 3 years. That strengthened link across the partnership has allowed any new service development to be co-produced with stakeholders, including parents and carers and young people as well, if possible. And reporting of the difference these new services have made sits within the SEND system and the SEND governance systems. So we've had an increase in the speech and language therapy establishment to support young people and adults with learning disabilities, with a particular focus around preparation for adulthood. We've been able to develop a sensory processing service, which was an area of unmet need, which was raised frequently by families and schools. And we had a steering group of partners to co-produce that service offer. I've just taken a screenshot of the website that was produced as part of that development of the sensory processing service, because we were very keen to set up a universal set of information that anybody can access, didn't need a referral to occupational therapy. And that website was absolutely designed by parents and carers and young people. It's not on the trust corporate template. It's not designed in the way OTs really wanted to put the information. It's designed in the way exactly the parents and carers, young people told us they wanted and how they wanted to find the information. And it went live in September of this year. Through being linked in with those conversations around unmet need, we've changed the way therapies work in some of the special schools in the area to really strengthen partnership working with education staff. So we're talking about a universal health offer embedded within Quality First Teaching, where therapists support school staff with not only training, but work in the classrooms alongside teachers to develop their practice in terms of supporting them to implement the knowledge they have around communication friendly environments, sensory regulation, positioning children ready to learn. So health recommendations, but how they embed that into their classroom teaching. I know those graphs are very hard to see, but the gist of them is the first graph is the data that we have where teachers rate the difference in their knowledge and confidence to deliver health recommendations within the classroom environment. And you can, the 3 different colours are across speech therapy, physio and OT. And you can see just on that graph that it shows that teaching staff made a significant improvement in their skills and knowledge to deliver health recommendations as a result of that classroom-based focus. And the second graph is where the teaching staff rated the perceived difference in people's activity and participation in lessons as a result, and that's significantly positive as well. So we can collect some data to show that different way of working has a positive impact for children and young people in terms of readiness for learning. On the next slide, please. I'm not going to read out those quotes. They're there for you to be able to look at yourself while I'm talking. But just thinking about that integrated partnership working and the impact of the SEND strategic lead role within that. And there are quotes there from the director of the Parent Carer Forum, the DCOs that I work with, and the AD for Commission and Partnership and Transformation in one of the local authorities. But as we all know, partnership working is critical to drive forward improvements in SEND, and strong communication and having children and families at the centre of our work. So this role really complements but is distinctly different from the DCO, and the benefit of the role is absolutely working in partnership with the DCO. So the value I feel of my role as SEND strategic lead within the provider organisation is that I can coordinate from within the organisation the improvement work that needs to happen in relation to SEND, because I'm part of the organisation and have those networks. And I think that has had a huge impact working alongside the DCO, as evidenced by some of that feedback, that together we can really work to support the health contribution to driving the SEND improvement work together as a partnership. Just on the next slide, please, Thea. It hasn't been easy. I won't pretend that it is. There are challenges. Leading across 2 local areas is difficult. Ensuring that the improvement work from a trust perspective is tailored to the needs of local populations. But we are one provider, so we also have to think of equity of provision, and I have to be mindful of that when I'm thinking about the improvement work in North Tyneside versus the improvement work in Northumberland. Coordinating improvement work across organisational boundaries, as we know, is challenging. Some of the challenges, particularly during COVID, because this role started at the time that the national the pandemic hit, is a variable understanding across the partnership of how health works. So sometimes there could be challenges in helping partners in the local authority and social care understand why SEND wasn't as high a priority as everybody feels it should be. And that's because there's huge conflicting demands on NHS time. And when my organisation is thinking about ambulance handovers, flow through the emergency hospitals, discharges, all of those things. So trying to keep SEND on everybody's agenda as well is challenging. There's no denying that. Leading across different business units in the trust, it would be much easier for me if all services working with children and young people were in one place with one governance system, but they're not. So there's that side of things as well. And each business unit's competing priorities and their expectations of what services have to deliver, keeping the SEND conversation live within that across the organisational boundaries. And the time needed to do this work, and just preempting questions that might come up at the end. I was allocated this role. I absorbed the role as part of my existing role, so I have no ring fence time. I have to prioritise alongside the other things that I need to do, and that is a challenge, no denying it. So just on the last slide, just thinking about sustainability and replication. If this role was to be considered in a provider organisation that doesn't have one already, there really needs to be buy-in right from the executive leadership level to the operational level and to service leads and staff within that. There needs to be agreement about who will be responsible within an organisation for fulfilling the SEND responsibilities. I think there needs to be an understanding of the role across the partnership, so that the SEND strategic lead in the provider organisation is included in the relevant meetings, has the relevant board membership, has sight of key strategic documents, and it's making clear the importance of the benefits of the role. One of the huge things is having a named point of contact within the provider organisation. So the benefits of the role to our partners and how that's distinct but complements that of the DCO. For me, it's not an either or, it's them both working together. That's been the success. A clear job description and ring fence time. Another question from the previous workshop was about my job description. I don't have one, not for this role anyway. So thinking about, a new organisation setting something up around this, thinking about what those roles and responsibilities are. Anybody who does this type of role, I think, would need to be experienced in leadership and management, and experienced in partnership work and across services and across organisations, and have dedicated time to do it. I have been working with NHS England as part of the expert advisory group, looking at the different role descriptors, including that of the DCO and DMO, and there's ongoing work around that. But the role descriptor for my role as SEND Strategic Lead in a provider organisation is published on the Council for Disabled Children's website, and there's a link to it there. And it kind of encompasses the things that I've talked about, but in a little bit more detail. So if there was any organisation thinking about creating a role like this, there is a go-to place to think about what a job description might look like. I think the details behind a job description would reflect the geography in the local area. I think it's hard to write a distinct job description, but a role descriptor covers those key descriptors and responsibilities, and are a reflection of what I do and the few colleagues around the country who do a similar role. So that is published and available, should anyone find that helpful. And I've timed it perfectly again. There you go. 10 minutes left for questions. So I hope that's been useful, and I'm happy to take part in a discussion or answer any questions if anybody has any. But Thea's going to monitor the chat for me. Thank you.
Thank you so much for that, Gillian. That was brilliant. We do have a question in the chat, which is, do you have a clinical reference group as well as the SEND forum?
No, we don't. The SEND forum kind of covers both things. It's an organic agenda that evolves depending on the needs at the time. When the SEND forum was first set up, it was very much about devising a trust SEND action plan, because there were so many things we needed to do, and certain people knew this and someone was taking a lead on that, and it was pulling it all together. Now that we're 3 years in and much more established, the forum has taken on a different role. So there's some training, there's some governance, it incorporates different things, and it's depending on what staff want and what information comes down or comes down from the SEND strategic board. So it's a one size fits all at the moment.
And we've got Camilla with her hand up.
Thanks, Gillian. That was so helpful. We're setting up something slightly different along slightly different lines, but certainly looking at within our main provider in Somerset, having this kind of what you could a SEND forum, which sounds just what we need, and we're already sort of outline planning it, so it's given me lots of food for thought, so thank you for that. What I'd just be interested in know is sort of what level are your SEND champions at? Because we have inclusion champions at Somerset that are very much sort of frontline staff, but what I'm thinking of together is when looking at something like a SEND forum, where we're looking at all that data, of having somebody possibly with more of a leadership role in services. I was just interested as to what you'd done with that.
Most of the SEND champions are service leads. So it's the physiotherapy lead, the speech therapy lead, the OT lead. If they're not a service lead, they are a senior member of staff with some leadership level of responsibility. So yes, because it's a cascade effect of trying to affect change. So I expect that SEND champion to then go back to their service, not just pass on that information, but affect change, the agreed change in their service. So yes, they are service leads or someone with leadership influence.
Thank you for confirming that. Yeah, that's what I was thinking was going to work for us, and it's reassuring that that's what you found in practice works. Thank you.
Yeah.
Excellent. Are there any other questions from anyone? You can feel free to post them in the chat, or take yourself off mute if you're feeling brave.
One of the questions in the, just by people, I think one of the questions in the workshop I've just carried out was, how much time does this take? Because even though I said I absorb it as part of what I do, I would say it takes approximately a third of my working week. I work full time. I could easily make it a full-time job. There are so many things I don't have time to do, but attendance at those things that I've talked to you about today, probably I spend at least a third of my week on every week. So just to give you a kind of ballpark figure of the time it takes.
Natasha has her hand up.
Thanks, Gillian. It sounds like you've really done well at establishing the role, and I just wondered whether, when you started, you know, did you kind of just volunteer to do it, and did you get resistance from your managers, kind of saying, no, you know, you've got other things you should be doing? Yeah, I just wondered how the dynamics worked out in terms of that.
No, I recognised that it might be helpful. I volunteered, but it was absolutely supported by my managers. I think there was an increase in awareness in the organisation that there was some improvements needed, but unsure how to approach that and how to do it for those reasons I talked about. You know, it's coordination across 7, 8, 9 different services in the trust, more working with children and young people. So the biggest pressure area to start off with was that senior people in the organisation were aware that we weren't returning AHC needs assessment advice within timescales stroke at all. So that was some of the catalyst. And then how do you go about doing that? Because there's so many services write advice, never mind do we know what quality it is. So it was something I'm hugely passionate about. I had experience, I volunteered, and it was completely supported by the leadership team within the organisation as well. If I was going back and having those conversations again, I would ask for ring-fence time to do it and a clear roles and responsibilities. That's evolved over the course of me doing this job. It's been organic, and which is why I'm happy to share it, so that if I've learned something and that other people can take that on. But if I was doing it again, I'd ask for ring-fence time.
And Camilla?
Sorry, me again. I was just wondering, because with the sort of role that we're looking at in Somerset, we want to sort of embed it in sort of governance structure so that there is that feedback for sort of higher and get that sort of management buy-in at a senior level. As it send is 0 to 25, I'm struggling to see how that's going to work for more of those services that are more involved with, as they're in sort of transition towards the sort of adult services, because where the role's going to sit, it will be very much more in that sort of children and families directorate. Have you managed to get any, if needed, any sort of reach over into adult services, and have you got those sort of networks in place?
That's a really, really good question, Camilla. And I think a lot of the answer to that depends on your individual organisation and how it's structured. So one of the initial challenges was most of our children's services are 0 to 18 or 0 to 19. But because now governance is embedded within the trust governance framework, then that's how it filters in to adult services as well. So yes, a lot of services sit within our child health directorate, but I actually sit in the community business unit, which is not just children. Physio sit in the medicine business, which is not just children. So as we go up the higher levels of governance within the trust, and that's what I was talking about, the send ask, it's making sure the right people are aware of what the ask is, and the ask isn't just to 18, it's to 25. So I wouldn't say we've got it cracked, but I would say that we have that crossover into adult services at that leadership level in terms of what the ask is. There are still improvements we need to make, but I think we have those channels of communication and that system to be able to facilitate those improvements.
Great, thank you.
Excellent. Are there any other last questions before we wrap up? I think that might be everyone, but that was excellent. Thank you so much, Gillian. I thought that was so interesting, and thank you so much to everyone who's attended and been so engaged and sent through all of your questions. There's some really great feedback for you in the chat, Gillian. I will just very briefly share my screen. we do have a feedback form. It would be great if you could fill that in. I'll also post a link to it in the chat as well, but we've got a QR code which you can scan, and I'll post the link to the chat in the chat in just a moment. Oh, there we go. But other than that, so the sessions have ended now. You don't need to go back into the plenary session. You're free to go and have lunch, or enjoy the rest of your day. Thank you so much for attending.
Thank you for your help, Thea, with the slides. Perfect.
It's all right, no worries at all. I'll stop recording as well. So that's the other thing I forget to do.